Assalamu alaikum everyone. Welcome to today live stream. Uh, Actually, I'm really happy you are here because we are going to talk about something very important. It's all about depression and anxiety. So these two conditions are among the most common mental health issues in the world, but sadly they are often misunderstood. So many people think depression is just a sadness or anxiety is just normal stress, but the reality is much deeper. Uh, in this live, I will explain what depression and anxiety real are, uh, their key symptoms and difference, real life examples so you can relate, and most importantly, how they can be treated both emotionally, psychologically, and medication when needed. So, my goal is to keep everything simple, clear, and practical. So, whether you are learning for yourself or to support others, uh, you will you will walk away with valuable insights. So, stay with me till the end, and let's begin this important journey towards mental health awareness. So, first of all, let me to understand you. What is depression? So, basically, depression is a mental health disorder marked by persistent sadness, loss of interest or pleasure in daily activities, uh, feelings of hopelessness, low energy, and changes in sleep, appetite, or concentration. It's more than just feeling sad. It interferes with daily functioning. So, this was the short and briefly definition of depression. Now, we are going to discuss what is anxiety. Uh, you know, a lot of people suffering from anxiety, but they don't know what does it mean. What is anxiety? So I'm going to explain the anxiety definition. So anxiety is excessive worry, fear, or nervousness about everyday situations. You may see some people, they just worried. um, he thinks that what will happen next if I do that, if I work this like. So while some anxiety is normal, an anxiety disorder involves persistent uncontrollable fear that affects daily life, so often with physical symptoms like rapid heartbeat. You may see these kind of people, their heartbeat is sometimes abnormal, sweating, restlessness, or muscle tensions. So that was the short definition of anxiety. So we will explain the major cause of anxiety, and also we will discuss depression, its treatment, how we will approach to this. So stay with me, inshallah I will guide you line by line. If we talk the treatment approach, so we have both kind of treatment, psychological and emotional treatments. If we talk psychologically, you it's also called psychotherapy. You can say that talk therapy. So it is very important to talk these kind of people who are suffering from this kind of disease. We should sit with them and talk with them. And the second one is lifestyle and emotional support. If this kind of people, their lifestyle become changed, it's very important. Stress management, deep breathing, medications, mindfulness, regular exercise, these are very and very helpful um, lifestyle changes, which is very important. um, and also balance sleep and diet, because when your sleep is disturbed, you may suffering from a depression or anxiety. You may have some friends, I mean positive friends, whether you can share your thoughts with them. um, by the way, they can help you a lot, because sharing your thoughts with them, it's also an play a very important role. So if we talk its key point, so especially for depression, or we talk medication. As you know, by the way, if you see doctors, medical field related, they do not prescribe the medications. First of all, they refer the patient to go for psychologist or psychotherapist or psychiatrist, because these are the doctor who tell you the right way, and they can decrease your stress, anxiety, depression. So medication they prescribe when a patient goes for a longer depression or anxiety. So uh, if we give the short example of depression, you may understand very well. For example, a student stops enjoying in her hobbies, skip classes, and feels life is meaningless. So this was the short example of depression. And if we talk about the anxiety, what does anxiety? You may say, if you may say also a student, and you may spend your time in the classes. When we were at the 10th class, uh, I did my whole papers. It was good. I have written all the papers very well, but when the exam was near, I feel afraid from the paleness, from the failure of an exam. So uh, it is basically the type of anxiety, because the students uh, start fearing. He also know I did my paper very well, but when the thoughts come in his mind, and he is suffering from the conditions where he feel fear, so that was the condition of anxiety. In short way, if we understand anxiety and depression, so you can say a mental health condition where a person feels sad, hopeless, or loses interest in activities often for weeks or months. This was the briefly definition of depression. And if we talk about anxiety, its brief definition, a condition where a person feels excessive worry, fear, or nervousness often about the future. It's related to future, especially anxiety. People are thinking about its future. If I do this work, what will people say about me? So these are all the signs and symptoms of anxiety. So may you call it an anxiety. So here is i'm giving I'm giving you a very motivational quotes, which is related depression and anxiety. So listen it carefully. Your feelings are valid, but they do not define your future. It's okay to not be okay. Asking for help is a sign of strength, not weakness. Every small step toward healing is a big victory. And keep going. Keep going. So, um, take care of yourself, take care of your friends. If someone suffering from this kind of disease, especially depression and anxiety, so if you know very well, so you can treat them. If you know about anxiety and depression, so you can guide them all and set them, guide them, and release them from depression and anxiety, because it's a very tough situation, whether the people suffering from depression anxiety, so we need to help them. So uh, thank you so much for joining me in today's live session. We learned that depression is not just sadness and anxiety is not just worry. Basically, they are real medical conditions that affect millions of people. Support therapy, lifestyle changes, and sometimes medications, people can recover and live fulfilling lives. So if you or someone you know is struggling, remember you are not alone. Reaching out to family, friends, or a mental health professionals can make a huge difference. I hope today's discussion gave you clarity and strength. If you found this session helpful, don't forget to like, share, and subscribe so more people can benefit and spread awareness. So take care of your mind just like you take care of your body, because mental health matters. Until next time, stay positive, stay strong, and remember every step towards healing counts. So thanks a lot, and inshallah, um, I'll come again in next live session, and we will talk about the other kind of disease. Okay, thanks a lot.